Pfizer and Biontech making good on their promise to apply for emergency use authorization from the FDA for their COVID vaccine, with that application coming today as cases across the nation approach a record 200,000 per day as the CDC pleads with Americans not to travel this Thanksgiving holiday season. Let's start there with Yahoo Finance's Anjalee Khemlani, who has the latest details on the status here with Pfizer and BioNTech's plans to get that FDA approval. And Anjalee, I mean, we've seen this research come by quicker than a lot of people expected, and now in the final innings.
That's correct, Zach. There are a lot of things to highlight about this emergency use authorization filing. First of all, of course, with Pfizer being a vaccine company, it's no surprise that they were able to get it this quickly. But BioNTech really adds a different flavor to this filing. And the same goes for Moderna, which we expect will also follow suit shortly, because it's validating that mRNA platform. It's never been tested on the market. So not only are we seeing a vaccine developed in record time, but also on a very new platform. And so that's really important to see just how well it does, of course, for the U.S. broadly and the world. But of course, this filing expected, and we did hear, of course, from them earlier this week after we heard that their vaccine was 95% effective, that they were going to be filing within days. And so right on par this week for that. Expecting some sort of information to come out of the FDA in the coming weeks. There is a vaccine advisory committee that needs to meet, as well as the FDA career individuals looking at this to then estimate when it might be out there. We know that states are already setting up to receive shipments before the end of the year, likely for that high priority group, which will include frontline workers, but still more details from the CDC needed in terms of who else will get it after. And then, of course, for the general public, looking at March or April for general public vaccination.
Meantime, Anjalee, when you look across the country, no real signs of these infection rates slowing down. We saw more than 187,000 cases reported yesterday. We've seen a number of states implement restrictions. What are you hearing from the doctors you've been speaking to about how effective this is likely to be, just given just the scope of the spread this time around?
Well, Akiko, that's sort of a mixed response, because there are some places doing it right and some places that are not. And this, of course, is a repeat of what we saw earlier this year. We have some states that have statewide curfews and restrictions. California looking at limits and curfews overnight on more than 90% of its population. Meanwhile, you have municipalities like New York City rolling back schooling to remote monitoring. And Illinois just saw a shift to more restrictions after Chicago had already put them in place. And then you see, at the city level, Philadelphia and Newark calling for restrictions and overnight curfews, but nothing really at the state level just yet. So this patchwork, level of restrictions and strategies is really making it harder to curb the pandemic. Meanwhile, in concerning states like South Dakota and Wyoming, which are hitting record numbers across all the metrics, no specific restrictions or strategies there. Meanwhile, in Texas, we know El Paso has done something, but at large, the state hasn't done anything. So once again, health experts are very concerned about what this means in the coming weeks and months, especially as we know, the incoming Biden administration has talked about mask mandates and the like. So that in-between period is really of concern right now.
All right, Anjalee Khemlani bringing us the latest there on the COVID front. Appreciate that.